mass is looking right at us. It's right in front. You know, it's right where we need it, and so we can get all the exposure and access we need. If for some reason we couldn't flip it, we couldn't get it into, we need it right in front of us so we can get the work done. Then, and I've had this happen one time actually. It was a tumor at the top of the kidney, and I just couldn't get access that I needed. I couldn't get the exposure. Struggled and struggled and struggled. This was years ago, but had to back up and make an old-fashioned incision. Based on the location, and if it was 10 years ago, before robotics and laparoscopic procedures kind of became mainstream.
For sure.
We would have, the discussion would have been kind of a flank incision where you can see if we made an incision here,
for sure, yeah,
it's going to be right there. So from an old-fashioned traditional surgery, that's very easy access actually through an old-fashioned flank incision. I don't like making those because they hurt.
Infection increases, right?
Not really, but mostly it's the problem with these incisions is that they go through the respiratory muscles every time you cough or deep breathe. You have to keep breathing after the surgery.
Area?
Yeah, and it hurts. So it's just a painful incision. If I could tell you, well, stop breathing for right?
She wouldn't mind.
You could, so it can be a painful incision.
Right.
And
I guess I'm used to pain after this back surgery. I have a pretty high tolerance to pain. I guess my thing is like what's going to be more successful in the end game. You know what I mean? That's you know what I mean? So.
Well, the bottom line is to get all of the mass, and if we can't do it, ideally we'd go in with small incisions, laparoscopically, flip the kidney, get everything done we needed to. That's the best case scenario. If that didn't, again, if we couldn't, we'd have to make an incision. If for some reason we couldn't get all the mass, this is another thing with surgery you got to be prepared for.
Is having to do it again?
Then we'd have to remove the whole kidney.
Right.
I'd hate to have to do that. Everything's about preserving as much kidney function as possible.
But if you have to take it out, you got to take it out. I had already parted with this after I heard they had the mass. I was already in the mindset of just take it. I've already had that concept.
And if because your other kidney, as you can see, it's normal and healthy, and it'd be more than enough kidney function to provide all the kidney function you need to survive for the rest of your life. We need to take care of it. You need to be monitored for diabetes and high blood pressure because when those things develop and they're uncontrolled, they can take out a kidney in short order.
For sure.
But it really we really try to preserve a kidney whenever we can. And you can see even though this dives pretty deep into your kidney, it does look like there's a little pseudocat. You see that little wisp, that little wisp. I mean, it's subtle, but I like to think that once we get it, we were at that spot, it actually is pretty easily gonna kind of peel off right there, or we can get it with a good margin. This black area is fatty tissue. There's no blood vessels or anything in there.
Okay, that's what I was curious what that black stuff was.
So yeah, that's all a sinus fat.
Okay.
So with surgery though, you never know what you're going to get till you get there. I mean that could be a blood vessel coming right there, and if we're in there and there's this big old blood vessel that's supplying half your kidney that's attached to this portion of the mass, that's the sort of situation where the whole kidney you just have to come out. The problem.
I'm sorry. Do you kind of when you go in there? Do you kind of look at the mass before you start cutting stuff out, and then you're like, okay, well, this is too voluminous in this area, or this isn't going to work out, so let's take out the kidney, or do you start trying to take out the mass and then you avert to take
Based
out the
on
kidney?
the information from the X-ray, no, I don't think there's anything we would find. Once we have the kidney exposed, everything's where we want it. We're looking at the kidney with the mass coming out. I don't think there's anything that would say let's just take the whole kidney. It's only a 4 centimeter mass. I mean it's big, but it's not like it's 12 centimeters or something. And I think I would say everything well, the game plan would be to save the kidney.
Definitely,
Yeah,
definitely.
You know, I don't know if there's anything we would find. I mean, otherwise, you know, going in, I mean, just based on the X-ray, you know, all the surrounding tissue, there's a lower portion of your spleen, but that'll all just, you know, when we remove the kidney,
away,
it's gonna, you know, that we're gonna separate it from there.
Okay.
There's really no reason why we couldn't get in there
Definitely.
and
I was just curious your mindset on it.
So if it did have to go to a full nephrectomy,
Uh-huh.
would you do that laparoscopically, or would you have to open up?
We would. Actually, a laparoscopic nephrectomy is a very simple, straightforward case.
Oh, okay.
That would actually be a slam dunk.
Okay.
Oh, really?
You betcha. The thing though
That
is that
alleviates a couple of
Is
blood
it the
pressure
bleeding?
points.
I'm sorry.
Is it the bleeding potential, or?
Well, there's always the worry about bleeding. The main reason that the whole kidney would have to come out is for some reason there was a serious problem with bleeding. But, you know, with the surgery, we temporarily clamp the artery and the vein while we're working on the kidney, so there shouldn't be much bleeding at all.
Yeah.
The bigger concern would be if we just feel like we can't get it all, because, you know, even though the x-ray, I think that we could, but if by the time we're in there, things just aren't going well, things are stuck, there's large blood vessels, you know, in the area, you know, again, if you take the blood supply to the kidney, it's going to wither away.
That's what
that could be dangerous.
Yeah, that's what I
so
thought.
in that situation, you have to take the whole kidney. Now, for me, the likely scenario would be if, if for whatever reason, robotically, laparoscopically, we were struggling, I would typically that would be the point where you undock the robot, you make an old-fashioned incision, and you do it open. I would probably...
And the old-fashioned incision is that flank there based on the location of
typically it comes off the tip of the 12th rib, and it'd probably be about that long. Kind of in this
I'm only filming you because I have ADHD, and I want to remember this. I apologize.
That would be the likely way that we would access. Sometimes we would do an incision below the
rib cage.
Below the rib cage,
Okay,
yeah.
gotcha.
Either I think would give us good access to what we need to do.
For sure.
But the typical progression of events is that if things just aren't progressing robotically, we would make an old-fashioned incision. If for some reason I was unhappy with the outcome, then we would then remove the whole kidney.
Can I ask you a question? How frequently do you have to revert to the old-fashioned form of the flank opening?
I've done it one time in about
Only
10
once.
years.
Oh,
Yeah.
okay.
Oh, wow.
So the odds of that are really slim.
But if it happens to you, the odds are 100%.
Right.
So
That's a good point.
It's
like that roulette wheel, right?
But again, as far as reverting to open, if based on the location, there is a potential greater likelihood for that. If I just if the kidney won't flip over, or I just can't get it to a spot where I think that we can safely
remove it.
I mean the key is you gotta have everything right in front of you where you want it.
Yeah.
You don't want to do anything blindly. You need
Right.
good exposure, because you don't want to cut into the mass. You need to get all of the mass. If you're doing anything blindly, and you end up cutting through it, you don't know it. You're not.
Yeah.
We're not helping you.
Gotcha.
We got to get all the mass behind, and that's why exposure is key. And if for some reason robotically we feel like we can't do it, especially in a young healthy guy like yourself, we really got to make sure we get it all.
Gotcha.
Yeah.
Well, I appreciate that concern. I was just curious exactly how you guys go about it. Because I've had a surgery that hasn't gone particularly well either, and that's why I ask all these questions. I apologize.
Yeah. Well, there's no guarantees with surgery. It's a big deal.
Definitely.
On paper, and what works out in real life can be two entirely different things.
But it seems like we have options if it doesn't go exactly as planned and things of that nature. It seems so.
And that's where the bottom line is as much as I'd like to avoid
removing the kidney
or an open incision. Where I train, that's all we did. People
I was just
did
going to say,
well.
it turns into a routine kind of surgery, doesn't it?
People did well. You're going to have scar about that long as opposed to multiple small ones. But
Sure.
ultimately, it's not once you've healed up, I think it's going to be totally fine.
So if you have to do the flank, what's the recovery time compared to like
Well, it's longer. There's more pain. You probably, may spend another day or two in the hospital. You're probably going to be on Percocet or kind of high-strength pain medications.
Gotcha.
Typically, with the robotic procedure, people are on, oral pain medication anywhere from, 3 days to a week. This is generally speaking.
Gotcha.
If you make an open incision, you're probably going to be on it for 2 to 3 weeks. So
Gotcha.
there's just a lot more pain.
Gotcha.
So it's not. I hate saying, but I gotta give you realistic expectations.
No, I really appreciate your honesty, because I'll be honest with you, the back surgeon that opened me up, he reminded me of kind of a used car salesman. So you're the opposite of that, you know what I mean? And I appreciate your honesty.
Well, situations like this, it's tough, and really, I feel like that's the one thing that I have to do, even if it's information, even if it's news I don't want to share. The only thing I can do is be honest. I mean, none of us are better off if after surgery you say, why didn't you tell me? Why didn't you tell me there was a risk for my decision? Why didn't you tell me that there's a possibility you're going to remove my whole kidney? That doesn't serve anybody.
I had already parted with it, honestly, when I heard about it, because I didn't even know you could do that. So this is a positive for me. And sorry to ask one more question.
Oh no, that's why we're here.
If you fully remove that kidney, doesn't my other kidney grow 25% in size, or is that a myth? I don't know.
Absolutely does. It's called compensatory hypertrophy, and it will. Yeah, it's pretty cool. It'll grow to to do the job of both kidneys. Gotcha. So you'll have, instead of 2 kidneys, you'll have 1 big kidney.
If I waltzed around with that other kidney, would I have to really hydrate more if I were active and playing sports or things of that nature? Just have to drink more frequently compared to others?
No. Otherwise, you're going to do everything is. You just live your life normally.
Okay.
Gotcha. If you're involved with high
contact
significant
stuff,
physical contact sports. And
Which
if you took a big blow, that'd be a problem.
I don't really do that anymore after the back surgery. I just go out and shoot around like an old white guy. That's all I do.
It's otherwise I'd expect everything to be
Gotcha.
Stay the same.
Gotcha.
So I had a question. If you were switching the location for access, is there a chance of twisting the artery in the vein, or is that already occluded anyway when you're doing this?
No, they're very
malleable.
Yes, and mobile and redundant, and it's pretty amazing how much traction and how much you can twist around. I mean, they're made to move around, so it's that shouldn't be a problem. If for some reason, say the renal vein is really, really short, or there's something in the anatomy that we just can't flip the kidney again. And these are things you don't know until you get there.
Once you get there,
that's where we just it would become obvious we just can't do it robotically, and that's where we make the flank incision.
So in terms of my symptoms, and I don't know if this is related to this kidney, but I was just going to mention it. When I stand up, I've been getting relatively lightheaded, and that's never happened to me before in the past.
You've had headaches?
And I've had headaches. Do you think this is a factor to that, or
I don't.
Just general anxiety might be the issue?
I all sorts of reasons for anxiety. We're talking, another surgery. You had a surgery in the past. Sounds like there were some issues with it. Now we're already talking another one. I mean, this whole thing came out of left field. It just kind of, hit you like a truck. As far as
pretty much,
So if you've got things on your mind and there's some anxiety, I'm going to tell you that's normal. I mean, how could you not have a bunch of things on your mind with something like this going on? The body's amazing. It's able to adapt to so many different things, and relative. You have to take my word for it. It's a smaller tumor. I mean, I've seen tumors the size of a basketball, and people don't even know they're there, just because the body adapts to it.
The only reason I ask that is because isn't the kidneys kind of crucial in terms of blood pressure and? So
but you've got great kidney function. The fact that there's one going on one, they're still working great, so they're doing everything they need to do.
Gotcha. Okay. Maybe it's just general paranoia on my end.
Which I think would be normal. I think it'd be abnormal to not have any, anxiety, paranoia, concerns or issues. So that all makes sense.
In terms of future prevention, how often should I get this looked at? And do you think I should, because we've done this CT scan of this area of me, do you think we should if I should go elsewhere and get my entire body looked at for anything else, or do you think this is
Well,
centrally located here?
I would, if the, you know, there's kind of routine things. Kidney cancer spreads to the lung, and it spreads to the liver, and it spreads to bone. And we can check those things with a chest X-ray. There's blood tests that check bone and liver function. If it actually, I know your liver's fine because the CT
you
doesn't
can
show
see
any
it,
masses.
yeah.
There's no swollen lymph nodes in the area where in the area where the cancer can spread to, which is typically here. And typically, you know, kidney masses, if it's only 4 centimeters, the likelihood of any spread is very low. And we don't even know this is cancer. I mean, it's possible that this is benign. Wouldn't that be great? There is a possibility for that.
Yeah.
And that's why,
And that's
you know,
about a 15 to 10% chance.
in that ballpark,
Yeah.
you know, and if that's the best case scenario, of course, because if it is, you know, we don't have to do any further workup. But you know that if it was removed, and we know if it is cancer, is it aggressive, is it not, what kind of cancer, that would, you know, help us to determine, you know, if we need to check anywhere else. But the basic chest X-ray and the basic blood tests, again, knowing that the cancer hasn't spread to the lymph nodes around the kidney, knowing it's not in the liver. Have we done a chest X-ray?
We haven't. That's what I was going to ask you.
We real quick, we did one of like my spinal area, but I don't know if we did a
Yeah,
full
they
one.
want to check your chest then.
No.
Okay.
But
so
you know,
I have a primary care appointment tomorrow. Should I ask them to refer me for a chest X-ray, or can you?
Oh, I just put in the order. And get it
Okay,
done.
gotcha.
But it'd be if it
wasn't
hasn't
sure.
been done, it's called a comprehensive metabolic panel, which will check alkaline
Yeah.
phosphatase, which
Yeah.
checks for the bone. It'll check the liver function. It'll check your kidney function. If it hasn't been done, I can put the order now to get it
I
done.
would really appreciate that.
That'd be great.
Let me do it right now then.
And it's just because I haven't been able to see my PCP since even our last interaction,
Yeah.
and so I just haven't had a chance to really ask my PCP how to, you
Is there
know,
anything
game
else?
plan this in
Yeah.
the future, and just to be more preventative, you know, because we found this out of blind luck to
Well,
some degree, you know what I
it's,
mean?
you know, based on your age and your health, I'm going to assume that this was just sporadic. In that, you know, if
Yeah.
it's cancer, and again, there's a possibility it's not, but sorry, I forgot where I was going with that. I'm trying to look up your labs here. Have
No
you had a
worries.
metabolic profile?
I don't know.
Oh, you have
if
not. Yeah, no, we need to do that.
Yeah.
And let me see if there's a chest X-ray in there. Yeah, just of your spine. Well, let me get the orders in now,
Well, thank you
and
so
we'll just
much.
get
Thank
it
you.
done. I'll call you with those results. If you're seeing your primary care doctor, if you do them, you can do them on your way out now. You don't have to be fasting.
Cool.
Yeah, let's
We'll
do
do
that.
that.
Yeah,
Yeah,
let's
we'll
just
do
do one.
that.
That's
And
fine.
then
Um,
let's see.
So,
I just gotta
I'll
make
let
sure I
you-
get my right and my left side.
Yeah.
This is the left side. So we'll do chest X-ray. And then we're gonna do comprehensive metabolic panel.
is there any, because Ryan is so young with this, is there any sort of genetic workup that we should look at?
You know, I would want to wait until the
if it's
final
confirmed,
pathology
yeah.
comes in to get more information.
Okay.
in terms of it being benign or not.
If
and
it's
all that.
cancer.
Well, or if it's cancer,
Yeah.
what kind?
Right.
Yeah.
Or if it's
Okay.
benign, what kind? Because there are some syndromes and such.
That's what I
that
wondered, yeah.
They can present that way.
Syndromes where tumors just grow. And
In the kidneys,
granted,
yeah.
Granted, they're not malignant, just benign.
Yeah.
And more frequent for people, kind of thing.
So order for the blood test and the chest X-ray is in. Let's do one other thing here.
What about like a brain scan? Just do they have to do that?
Well, typically, if you're having,
I'm
you know,
having
cognitive impairment and such, you know, I think we can make an argument for it. Until we know that this is cancer, typically the insurance, sometimes we struggle to get it covered because they're saying that it's not indicated.
Yeah. Okay.
But let me, what I always like to do, I like to pull up the guidelines on kidney this is for kidney cancer. Again, we don't know that it's kidney cancer,
Right.
but in the event that it is, let's make sure we're not missing anything in the workup. So, initial workup. So it says CBC, that's been done in normal. They want the abdominal pelvic CT, which has been done, chest x-ray, which we got ordered, and comprehensive metabolic panel, which has now been ordered. It says, if clinically indicated, a bone scan, a brain MRI, a chest CT, and it says consider needle biopsy. That's if clinically indicated. So so there you go. If you're having significant cognitive changes, severe headaches, there's things going on that would suggest there's a tumor in your brain, or that this is spread to your brain, that would be an indication to get a brain MRI.
Well, I've been having migraines. I've been misplacing things.
Really forgetful
really forgetful.
yeah.
And maybe I'm being a hypochondriac here, but over the past 5 or 6 years, I've noticed a pretty rapid decline in my ability to remember things.
Let's start with the brain. In my experience, that's a very uncommon. It's possible, but it's uncommon. Let's start with the chest X-ray.
Okay.
Let's start with the comprehensive metabolic panel, because if those show any evidence that cancer has spread, I think going from head to toe is the way to go. If those are totally normal, let's take it a step at a time. If that comes back up.
Could we wait until after the surgery?
If it's let's wait for all the information to come in and then decide. But if you're having again headaches that are above and beyond what your normal is, the frequency, the severity, or there's cognitive issues or something, you could make an argument that maybe we probably ought to do it.
I've never gotten lightheaded standing up, and I used to be a century cyclist, and you'd think those guys get dizzy all the time just standing up, and that's never happened to me before. And maybe I'm being a bit of a hypochondriac, but we found this tumor almost by luck to a degree,
Right.
And that's.
It was a back pain
So I
that
think,
you had.
I'm with you.
I appreciate
Okay.
So let's. I tell you what. Let's put the brain MRI. We'll keep it. Let's keep it on the table for right now. But let's get the chest X-ray and the CMP. Let's do that next, and then if I guess if you're having
Let's just wait and see.
We'll talk again. I'm trying to find. It wouldn't be unreasonable again if you're having symptoms in your head that are new to you, but let's.
I've been prescribed psychotropic drugs for my bipolar disorder, so I don't know if that's a factor. Seroquel's been known to cause kidney issues, and I used to be prescribed that. You know what I mean? And maybe there's just paranoia with me and the FDA there, but there's been lawsuits. So to say that it's not a viable concern without actually looking, I think is a bit presumptuous to some degree. But I appreciate you putting those orders in. I really do.
Oh yeah, no, let's get those done. The other thing, it'd be easy to biopsy this. Interventional radiology could come in with a needle. Look at that. It's just
it's right there.
It's just right there. And that could take to let us know pretty quick what it is. Is it benign? Is it cancer? In my mind though, even if it came back benign, based
Still
on your
want
age,
it out of there,
is that going to grow and grow and put the kidney at risk over time? I worry about it, and I am
the
worried.
ability for it to function in general would be an issue later down the road.
Can it somehow go? This is the spleen.
Mm-hmm. That's bottom of the spleen right here.
So
you can see it.
It's not
this
joined,
is the main
is
body.
it? Yeah. Okay.
No, they would fall apart if we flip the kidney forward. You can see
okay. Okay.
This is fatty tissue here, which is a good plane.
Okay.
So, but this bothers me because the heterogeneity here. I worry that's tumor necrosis, and that occurs with an aggressive tumor. But we don't know that it is. Again, maybe it's just a bunch of scar in there, and this is a benign, benign lesion. It's possible. It's the sort of thing where you never know. But to me, it looks worrisome. I hope I'm wrong. I hope it's benign. That'd be great.
Yeah.
But.
All right, well, you've given me a very good rundown, and I would actually like to schedule surgery with you, if at all possible, for sure.
Yeah, let's.
What is your game plan?
let's, yeah, I mean, that's all I need is a thumbs up, and we'll get the ball rolling. The way it works is I put in the information, my scheduler will get pre-authorization from insurance. The you know, we'll get you on the books. She'll call you with tentative dates and times to get it done, and we'll get it done.
Yeah, and I apologize prior because I just got this phone and I didn't realize that if you delete voicemails off your voicemail, it doesn't really delete them. So I missed some of your guys' calls, which is why we're kind of late at showing up for this again. So that was my bad.
Oh, no, it's okay.
So,
No, again, I know there's been
it's been kind of
been
a
a lot.
crazy
there's
past few
been
weeks.
a lot. It's been a whirlwind. Yeah, I
Yeah.
can try to imagine.
Yeah.
So let's yeah, if you get those labs at your earliest convenience, I'll do it today if you can, and then I'll put the paperwork in. It's the sort of thing where I'll have one of my partners there. This is kind of a two. I like one of my partners to assist with procedures like this. So
Sure,
we're probably looking.
The
at,
more the merrier, I think.
no, I mean agreed. You know, two trained sets of eyes and hands in there for the whole
For
thing.
sure, yeah.
We will. You know, before, you know, a spot on the robot opens up, you know, there's an opening for both me and my partner, so everything can come together. We're probably looking at least a month, just so you're aware. So,
Gotcha.
Okay.
Yeah,
so,
but
but I'll have Kristen call you, and we'll, you know, still give you tentative dates and times. You select the one you want.
For sure,
Okay.
for sure.
I think it's just knowing the date of it would be.
That would relieve
is,
so much of my anxiety. You know? So
Sure, just knowing that there's a
just
date.
knowing
that
it's
getting
gonna
done and
hopefully
over
get
with.
solved, you know, or at least we're gonna start to solve it, you know. And I appreciate all your honesty. I trust you more than any other person I've spoken to.
Well, I appreciate it. I'll do my very best to maintain your trust. We'll do the very best we can. That's what we try to do for everybody. But I know you're putting your trust and confidence in me, and that means a lot. And I'll do my very best.
Well, you've been very forthright and honest, and so I wouldn't imagine anyone else that I'd want to get this done. You know, and I needed someone to really hold my hand through this and show me what they're going to do. And,
Yeah, no, it's something most people have to go through. So so it's not like you can talk to your neighbor